Okay, so I wanted to take some time to demystify what happens in the operating room. So, in general, most patients will be asked to show up and they'll be taken to a preoperative area. That's where you'll meet the nurse that's going to be in your case. It's where you'll meet the anesthesiologist that's going to be in your case, as well as you will see your surgeon beforehand. The patient then gets wheeled into the actual operating room. At that point, usually the anesthesia team takes over, achieves anesthesia. After that happens, a lot of things start going on in the operating room. We have to position the patient. Then at that point, usually a surgical prep is done. And that means that a medical grade soap is used to clean the abdomen and usually the vaginal area as well, including inside of the vagina. Once that's done, then the surgical drapes are applied to the patient. And then a timeout, which is a procedure to confirm who the patient is, what we're doing, is then done. So we generally insert the Foley catheter to make sure that the bladder stays drained. And then we typically insert an instrument called a uterine manipulator. And this generally requires a speculum exam in order to do so. So this is quite frankly no different than having a speculum exam done in the office. We typically do that in order to visualize the cervix and then be able to place this instrument that goes through the cervix and actually sits inside the uterus for the course of the surgery. It helps us move the uterus around so that we can see all the areas around the uterus. It helps us keep the ureter, which is the tube that connects the kidney with the bladder, safe. Because of this, it's not uncommon that patients may experience, number one, some burning with urination after that Foley catheter gets removed. And number two, they might experience soreness in that vaginal area. Because of having to move that uterine manipulator around. It's actually an instrument that kind of has a curve to it. One end is sitting inside the cervix and the uterus, and the other end is basically coming out of the vagina and has a handle so that somebody can maneuver the uterus around outside with this handle that sits outside of the body. And so I wanted to demystify that, talk about that a little bit, because these are things that very frequently occur in surgery, but patients may not be aware of all that goes on from the time that they are put under anesthesia to the time that we actually start the process of surgery itself.